It will be critical to keep attention focused on CVD post-summit. And one of the key ways we believe is this army of activists that we've built. We now have really truly a CVD community globally. People working on the public health side of cardiovascular disease, people working on the clinical side of cardiovascular disease, and people working in prevention, all coming together and saying this is something that we have this political declaration. We need to make sure it's implemented. We need to keep the pressure on. We need to be a partner in the solutions. We need the resources, and really focusing ahead in particular on 2013, when the Millennium Development Goals will be renegotiated, ensuring that CVD is part and parcel of any plans moving forward. One of the critical ways that NCDs differ somewhat from communicable diseases is that the solutions to them, the causes and the solutions, lie outside of the domain of health. The causes of NCDs are related to things like tobacco use, unhealthy diets, physical inactivity, lack of access to essential meds, harmful use of alcohol. All of those actually are not within the health domain. And so similarly, the solutions need to lie outside of the health sector and need to be very broad and multi-sectoral. We need to work with agriculture, we need to work with transportation, we need to work with trade and tax around tobacco use, for example, and we need to create a health in all policies approach. So health has to be a component of every policy. NGOs will have a critical role in ensuring that there is a health in all policies approach post-summit to implementing the political declaration. They need to take leadership around educating others. NGOs across sectors need to work together. NGOs across sectors already are working together. That was one of the very special things that came out of the summit. We had environmental organizations, we had maternal and child health organizations, we had agricultural organizations, all coming together and saying NCDs are not just a health problem, they're everybody's problem, and therefore the solutions belong to all of us. The political declaration was remarkable, and we would like to take some credit for that in how comprehensive it was. We were very pleased with how long, in fact, it was, because there were so many different pieces, so many elements, and it showed the involvement and activism of so many different stakeholders. So from that point, we see it as a great success. However, we were very concerned that specific targets were really missing from it. Targets both in terms of time and in terms of numeric targets. For example, 5 grams of salt per person per day is one of the key targets that was in an earlier iteration of the declaration and now is not there. Specific time-bound targets around when certain actions will be achieved. That's why the work is only beginning. That's why the role of civil society is so critical. We are working hand in hand with the World Health Organization, with governments, and even with the private sector to ensure that there are specific time-bound targets that will be included as almost an addendum to the political declaration, that those targets will be agreed upon by member states next year at the UN General Assembly, and that we can then hold ourselves and each other accountable for achieving those targets. One of the next steps in ensuring the success of the NCD movement, which we've now started to see come together, is really bringing in the public, now helping the public to understand what an NCD is, because it's a term that really hasn't had much familiarity yet. We do have good champions like Lance Armstrong and others who've done a very good job of pushing it out there. Jamie Oliver, they took on advocacy and promotional activities leading up to the summit to educate the public about NCDs. We need to continue to find those champions and continue to work with them. We need to understand that there is an appropriate role, an ethical role for the private sector, for the food and beverage industry, for the healthcare industry, for the device industry and others in NCD prevention and control. Although there is not a role for them in setting policy, they have a very important role in implementing policy. So bringing together public and private sector is actually very much the role of civil society, and we see NGOs as taking a leadership role in that space.